Welcome. This video contains vital information about the pediatric polio vaccine. It was developed for healthcare providers working at Indian Health Service, tribally run, and urban Indian healthcare facilities. My name is Dr. Jasmine Curry Thomas. I am a member of the Navajo Nation and resident in family medicine. I'm partnering with Native Boost to share this presentation with you today. For those of you who may not be aware, Native Boost is a project at the Northwest Portland Area Indian Health Board dedicated to sharing accurate, high-quality childhood vaccination resources with Native people and their medical providers. To access Native Boost patient education tools, you can visit www.nativehealthresources.com, click on the Resources tab, and filter resources by the Native Boost campaign. Okay, let's get started. Today we will discuss essential information about polio infection, polio vaccines, and current polio vaccination recommendations for infants and children. I will also share useful talking points you can use when speaking with parents and caregivers. Finally, I will offer some additional resources. Poliomyelitis is disease caused by polio virus. Something important to know is that most cases of poliomyelitis are mild. In fact, an estimated 70% of children who are infected with polio are asymptomatic. However, as we know, even asymptomatic patients can still spread the infection. Of those who experience symptoms, 24% will have low fever, sore throat, and complete recovery in less than a week. This mild form of polio that causes flu-like symptoms for a few days and doesn't lead to long-term issues is commonly known as abortive polio. For those who experience more serious impacts of poliomyelitis, 1 to 5% will have non-paralytic aseptic meningitis, and less than 1% of polio infections will result in acute flaccid paralysis that is often permanent. Overall, case fatality for a symptomatic polio infection is 2 to 5% for children and 15 to 30% for adults and adolescents. Next, we will discuss the epidemiology of polio. The incubation period is 3 to 6 days after exposure for non-paralytic poliomyelitis and 7 to 21 days for onset of paralysis and paralytic poliomyelitis. Polio virus is primarily transmitted via fecal-oral contamination. However, polio can also be spread through respiratory droplets. Humans are the only reservoir host for the polio virus. Finally, polio is highly infectious, especially just before or after the onset of symptoms. Prior to vaccination, large outbreaks occurred in the U.S. and other countries in the Northern Hemisphere in the early to mid-1900s. The last case of wild polio infection acquired in the U.S. was in 1979. In 1988, polio caused greater than 350,000 cases of paralysis worldwide in 125 countries. Now, globally, polio cases have been reduced by 99.9% through vaccination efforts, with only 2 countries considered to have endemic wild polio virus transmission. As of December 4th, 2024, 81 cases of wild polio virus and 33 cases of circulating vaccine-derived polio infection have been reported worldwide. Now let's take a moment to discuss the ins and outs of the polio vaccine. Today, inactive polio virus, or IPV, is the only version of polio vaccine used in the U.S. Previously, live attenuated oral polio vaccine was used, but to reduce risk, it was discontinued in 1999. Notably, the polio vaccine can be given as a standalone vaccine or as a component in one of 5 currently available combination vaccines listed on this slide. Clinical studies of inactivated polio vaccine in the U.S. and in other countries have demonstrated 95 to 100% seroconversion after doses 1 and 2 that are given at 2 and 4 months, as well as after additional doses given from 6 to 18 months. Seroconversion has been demonstrated to protect against polio infection. Immune responses to polio vaccines are also protective when given in combination with other vaccines. In clinical trials, injection site erythema, swelling, or redness was seen in 0.5 to 29% of recipients. These side effects usually resolved within 48 hours and were more commonly experienced with the first or second doses of the vaccine. The proportion of vaccine recipients with systemic symptoms, including irritability, tiredness, anorexia, fever, and crying, were reported. The percentages shown on this slide are for when IPV was given along with DTP, or whole cell pertussis vaccine. The ranges include the minimum and maximum percentages for any dose, 1 to 3, at 6, 24, and 48 hours after vaccination. There was no increase in these symptoms compared to when DTP was used alone. This suggests that the DTP vaccine, particularly the whole cell pertussis component, was mainly responsible for these systemic side effects, not the polio vaccine. Following the change from OPV to IPV, vaccine safety monitoring in VAERS did not show any increase in adverse reactions reported for IPV, and there have been no cases of vaccine-associated paralytic polio seen with the use of the IPV vaccine. Ingredients in IPV include 0.5% 2-phenyloxyethanol and 0.02% formaldehyde as preservative. The vaccine also contains trace amounts of antibiotics, neomycin, streptomycin, and polymyxin B. When it comes to vaccine recommendations, to ensure vaccines are safe and effective, vaccine recommendations are continuously updated based on new information from disease surveillance systems like the National Notifiable Disease Surveillance System and the Active Bacterial Core Surveillance System, the Vaccine Adverse Event Reporting System, VAERS, as well as the Food and Drug Administration, vaccine manufacturers, and independent researchers. The CDC Advisory Committee on Immunization Practices, or ACIP, is the body that reviews this data and determines the recommendations published in the CDC immunization schedule. ACIP is a group of clinicians, researchers, public health experts, and at least one unaffiliated community member that meet at least 3 times per year. ACIP meetings are open to the public to increase transparency and public trust regarding vaccine recommendations. When it comes to the polio vaccine, the CDC immunization schedule recommends routine vaccination of all infants without a contraindication, recommending a 4-dose series at ages 2, 4, 6 to 18 months, and then 4 to 6 years. Make sure to administer the final dose on or after age 4 and at least 6 months after the previous dose. Note that 4 or more doses of IPV can be administered before age 4 years when a combination vaccine containing IPV is used. However, dose is still recommended on or after age 4 years and at least 6 months after the previous dose. Those who have a history of severe allergic reaction to vaccine component or following a prior dose of the vaccine should not receive the vaccine. Pregnancy is a precaution to IPV use. Although no adverse effects of IPV vaccine have been documented among pregnant people or their fetuses, polio vaccination is not routinely given to pregnant people. However, if a pregnant person is at increased risk for infection and requires immediate protection against polio, IPV vaccine can be administered in accordance with the recommended schedule for adults. Moderate or severe acute illness with or without fever is also a precaution for the use of polio vaccine. You may have thought during this section of vaccine recommendations, wow, this is getting a little complicated. If only there was an app for that. Well, there is. The CDC Vaccine Schedules app is a great resource for vaccine recommendations. It is available for download for free for both iPhone and Android phones. The app is continuously updated with the latest immunization schedules for children and adults. It also includes catch-up schedules for people who may be under-immunized, as well as the most recent information on vaccine precautions and contraindications. So to recap thus far, we have discussed the polio virus and vaccine, as well as current vaccine recommendations for infants and children. Now we will discuss strategies for talking with parents and caregivers about polio vaccines and vaccines in general. Notably, suggested approaches and talking points are based on research conducted by Native Boost. In 2024, Native Boost conducted 11 focus groups to gather the thoughts of tribal community members and healthcare providers and clinic staff in the Pacific Northwest. In the end, we spoke to 58 providers representing 12 tribal and 2 urban clinics and over 44 tribal members from across the region. Through speaking with community members, we learned that they want to learn the basics about what the disease is and why vaccines are important via face-to-face conversations with trusted medical providers. Thus, when educating parents and caregivers about polio, it is important to take time to discuss what polio infection is, as well as the potential consequences of not vaccinating against it. Something to keep in mind when speaking with Native people is that it's vital to use clear and concise language and to avoid using medical or scientific jargon. During talking circles, many parents and caregivers expressed that they did not understand or relate to medical or scientific terminology. To avoid making their providers feel like they are being challenged, Parents and caregivers commonly said that they avoided asking questions about concepts or words that they did not understand. So, as a provider working with Native people, when you use medical or scientific jargon, you are missing an opportunity to effectively communicate valuable information to your patients. When it comes to speaking with your patients about polio infection and the potential consequences of not vaccinating against it, consider saying something like this. Polio is an infection that spreads easily. It can cause damage to our brain and nerves. When this happens, people may not be able to move parts of their body. Some even need help breathing for the rest of their lives. Most people who are infected with polio don't show any warning signs, but they can still pass it to others. Thankfully, there are vaccines that can help protect everyone starting at age 2 months. Then consider letting parents and caregivers know just how effective polio vaccines are by saying something like, I let all my patients know that polio shots are effective. Most children who are fully vaccinated will be up to 99% protected. And if your child gets vaccinated and then happens to get sick, which is very unlikely, their illness will probably be mild. And then, if asked why polio vaccination is needed when there is no polio in the US, explain that circulating polio viruses in other countries can reach us whether we travel or not. Based on Native Boost research, one of the topics Native parents and caregivers were frequently interested in was vaccine safety, particularly as it relates to Native people. To address parents and caregivers' concerns about polio vaccine safety, make sure to let them know that since polio can result in serious health issues like the inability to move and trouble breathing, we have been regularly vaccinating kids against it in the US since 1955. Since the polio vaccine was approved, millions of Americans have safely received the vaccine, including American Indians and Alaska Natives. Make sure to remind your patients that serious reactions to vaccines are uncommon by saying something like, if you feel hesitant about vaccinating, keep in mind that serious reactions to vaccines, like the polio vaccine, are extremely rare. You're more likely to get hit by lightning than have a severe allergic reaction to any vaccine. Based on Native Boost research, it's also important to normalize mild vaccine side effects. Make sure to emphasize that after receiving the polio vaccine, like any vaccine, children may experience mild side effects. Consider saying something like, when it comes to the polio vaccine, common side effects may include fever or pain, redness or swelling where they got the shot. Mild side effects are a good sign that your child's body is preparing to fight polio. Within our bodies, each of us have warrior cells, also called antibodies. They stand guard and attack disease. Vaccines like the polio vaccine help our warrior cells see and fight disease. For example, when we get the polio shot, the ingredients in the shot tell our warrior cells how to recognize and fight against polio. Sometimes, when our warrior cells are preparing to be able to fight, they cause mild side effects. These side effects are not a sign of illness. They're a sign your child's body is getting prepared, if needed, to fight polio in the future. Most mild side effects usually go away within a few days. If anything seems unusual or you are unsure, call the clinic. We can help. To summarize, thus far we have discussed the importance of educating parents and caregivers about the basics of polio, including what polio infection is, as well as the potential consequences of not vaccinating against it. Based on our research, we emphasize the need to use clear and concise language, void of medical and scientific jargon. We also offered language that can be used when discussing polio vaccine effectiveness and safety, and the need to normalize the experience of mild vaccine side effects. Now we will discuss strategies for sharing culturally resonant messages with parents and caregivers that center a Native perspective. Something tribal community members said would encourage them to get their kids vaccinated when asked about effective messaging around vaccination. Tribal community members commonly express the desire for providers to emphasize the benefits of vaccination from both an individual and community perspective. To do so, consider reminding patients that vaccination protects their child and others in the community. Also, remind parents and caregivers of their responsibility to care for one another and for generations yet to come. Finally, make sure you present information about vaccines in a way that honors parents and caregivers' autonomy and individual sovereignty. This includes providing information about vaccines in a non-judgmental, empathetic way that affirms parents and caregivers' experiences while sharing accurate information. As medical providers, it's critical to listen to patients' concerns, take time to share basic information about vaccines, answer questions, address myths, and accept that parents and caregivers have the power to determine the right choice for their child and family. To enhance your knowledge about polio and other vaccine preventable diseases, there are a few resources I'd like to share. First is the Epidemiology and Prevention of Vaccine Preventable Diseases, also known as CDC's Pink Book. This comprehensive manual provides detailed information about vaccine preventable diseases and all vaccines on the CDC immunization schedule. The most recent edition was published in 2021. Since then, however, there have been changes made to the schedule. To ensure you have the most up-to-date information, make sure to check out the CDC 2025 Child Immunization Schedule. The CDC 2025 Child Immunization Schedule can be found on the CDC's website or accessed on the CDC Vaccine Schedules app. Finally, if you would like to access culturally resonant patient education materials offered by Native Boost, visit www.nativehealthresources.com. Also, check out www.indiancountry.echo.org/boost for additional trainings for medical providers working at Indian Health Service, tribally run, and urban Indian healthcare facilities. Thank you for watching this presentation. Together, we can increase the number of Native kids who are protected against polio and other childhood illnesses.